So first of all, we should clearly communicate about the disease, its pathophysiology, and its possible complications. So parents should be prepared, mentally prepared with the possible complications also, and what steps they should take in case of emergency. Like in small molecule accumulation disorders, these patients present with intermittent symptoms. Like propionic acidemia, methylmalonic acidemia patient, they remain normal. They remain normal with some limitations, with some symptoms, and whenever they are having any intercurrent illness, during that intercurrent illness, they go into catabolic state, and they land up into the emergency department with encephalopathies or acidosis, fast breathing, and other seizures, other manifestation. So, so it's very important to give an emergency letter to all of these patients so that whenever they are having symptoms or they are having emergency, they can reach to a nearby hospital, and the doctor, if they are not very well versed with the inherited metabolic disorder, but they will come to know about the disease and what treatment should be given during the emergency. So emergency letters should be given to all these patients so that in emergency the treating doctor can know about the treatment and symptoms. And second important issue, second important is support groups. The role of support group is very important because there are very few clinicians across the country, and the number of patients is very high, very high. The number for in different estimates, the number can be up to 1 to 2% minimum, but it can go up to 4% if we're able to identify all these patients out of total population. So number is very high. Like national policy for rare disease clearly mentioned that 6 to 8% of the population is estimated to suffering from one or other rare disorders. So there are around 7,000 rare disorders. Out of these 7,000 rare disorders, uh, around 1,900 disorders are inherited metabolic disorders. So number of inherited metabolic disorders is very high, and it's not possible to get a expert help every time, each and every time for these patients. So the role of support group is very important because the parents of a patient, they understand disease very well, even more than clinicians. So they can support. There are few groups like in Jaipur. There is a group, Merd India. They are supporting many such kids, and they are supporting. They are giving financial help also. They are providing medical foods also to patients suffering from inherited metabolic disorders in Jaipur. Similarly, there is an organization, Rare Disease India Foundation. They are also helping the kids suffering from different lysosomal storage disorder in identifying their needs and providing them help. Yes. One more organization, ORDI, is also working in this area. LSDSS, Lysosomal Storage Disease Support Group, is also working in this area. So these organizations are very important because they can fill the gap. So they have their own, they have their websites, and Merd India, they are having their WhatsApp group also, and they are available on the website. They are having their
Okay.
own website also.